I'm Dr. Rachel of Evolved Dental Healing, holistic dental practice in Brisbane. And today I'm going to talk to you about receding gums, what causes gums to recede and how you can stop it from happening. Because it's important that we protect your teeth and gums if you're going to have a healthy smile for life. So let's look at receding gums. When it comes to gum recession, there is a lot of misinformation and misunderstandings out there in the internet land, and even in the way that us dentists have been taught on this topic itself. So depending on what you read or who you're speaking to, the information can be confusing, it can be contradictory, and some of it will tell you that you can even grow your gums back and others say you can't. And then it comes to the causes of your gums. Are you brushing too hard? Or is it because you have gum disease? But is there more to receding gums than that? Well, in this video today, I am going to help dispel those myths around the receding gums and offer support on how best to address gum recession to stop it progressing and making sure it doesn't get worse in your mouth. So to understand why your gums recede, it's important to know a little bit about the anatomy and physiology and what's behind it. So let's look at what makes up your gums, shall we? So the gum anatomy basics. Your gums are really nothing more than a layer of skin over the bone that sits around your teeth and jaws. And the gum tissue will stay strong and high on your teeth as long as the underlying jawbone is intact and healthy. In other words, gum recession is going to occur if the bone that supports the gum tissue is withdrawn or it is damaged or destroyed. And that can happen due to inflammation, infection, or trauma. So the answer, in part anyway, to what causes gum recession is figuring out what are the main factors that are causing the jawbone height to diminish. There are really four main causes of this change in jawbone height, and these four main factors that cause the jawbones to shrink or demineralize are: number one, periodontal disease. This is an advanced gum disease. 2, Bruxism, what's called clenching and grinding your teeth. 3, trauma, and 4, genetics. And today I'm not going to discuss around the nutritional factor. I'm going to be looking very more at the jaw itself and not general nutritional deficiency, which can also play a role in the process. In a healthy mouth, we have jaw around all sides of our teeth, like a sleeve covering our arm all the way up to our wrist. However, in some people, this covering of bone is not an even thickness on all sides. And often the layer of the bone on the outer lip or the cheek side, that can be very, very thin or even non-existent for some people. And this thinness of jawbone tissue on the outer side of our teeth plays a very key role in understanding what causes gum recession. So getting long in the tooth. What causes this process? What causes the loss or demineralization of the jawbone? Now, it doesn't happen overnight. The bone becomes demineralized first, but the overall structure of the bone remains intact. So as long as the scaffold of the jawbone is still there and it's still in place, that can remineralize, assuming the cause has been effectively addressed. However, once that scaffold-like structure of the bone starts to demineralize, the gum tissue has nothing to support it, and it has no structure to remain high and tight around your teeth. And interestingly, this bone loss does not immediately cause the gum to recede. At this point, the gum tissue is very vulnerable to recession. So without the underlying support of the bone to keep it in place, any aggravation to the gum can provoke it to recede. It is at this point, when the underlying bone has diminished, that things like brushing too hard or incorrectly can most definitely cause gum recession to occur, but it's not the reason, it's a factor. So how do we stop gum recession? Well, to stop the gums from receding, we've got to first identify what's causing the underlying bone to shrink and demineralize. So let's have a look at these reasons. Gum disease. Now, gum disease is so incredibly common in our modern times. it's worthwhile to assume that you have an active infection and gum disease until it's been told you haven't. Now, recent research in the dental journals state that 50% of 30-year-olds and over 70% of 50-year-olds have periodontal disease. A periodontal disease is gum disease that has advanced to the point where the jawbone is being compromised and destroyed by bacterial infection and inflammation. The bad bugs in gum disease not only directly destroy the bone tissue, but they also cause our immune system to go into full red alert. And in an attempt to stop the infection, our defense mechanisms, our immune system, it creates inflammation. And it creates this inflammation locally in the gums. Now the problem is when this inflammation and infection is chronic, you get chronic inflammation, which contributes to the breakdown of the jawbone health. So if you have bleeding gums, bad breath, sore gums, receding gums, loose teeth, or teeth that are drifting or moving out of position, then you must get your gum health properly assessed and treated by a dental professional, because these are common signs of gum and periodontal diseases. Bruxism. That's the proper name for teeth clenching and grinding. Research shows that the cause of teeth clenching and grinding, and is bringing it to light and allowing our profession and people to understand more about why people grind their teeth and what we think about it is incorrect. We think it's down to the stresses of modern day life, and that may play a role, but we're finding more and more that nighttime grinding is strongly related to sleep apnea. If you grind your teeth, you owe it to yourself to find more about this connection between teeth grinding and airways and airway difficulties, because this is now becoming very big in dentistry. So whatever the cause of your bruxism, it's clear that if you habitually clench and grind the teeth, it's going to lead to a breakdown in the strength and the structure of the surrounding jaws. How is that? Well, imagine rocking a fence post from side to side on a regular basis. Eventually the soil opens up around the fence post and it gets loose. Now, if we apply that analogy to clenching and grinding your teeth night after night, your teeth rock in their bone socket. That leads to bone loss, bone damage, and gum recession. Trauma. It goes to say that you don't want to get hit in the mouth. You don't want to be smacking your teeth and your faces into things. It hurts. And the trauma of that one accident can literally cause irreversible lifelong damage. Gums and teeth like to be massaged gently with your toothbrush. They like to be stimulated and not smashed around. So don't brush too hard or carelessly. If you want to protect your gum structure, you've got to treat it gently. Genetics. Okay, so the thickness of the facial, the outer jawbone, that may be a matter of genetics, just like we're born with variations like thick skull bones, fine or thick hair, or how thin your jawbone is may have a genetic underlying component. Some people may even be born with a complete lack of bone structure on that gum surface on the facial side and have gum over the tooth only. So when this area of jawbone diminishes, the gum tissue that was being supported becomes very at risk of recession. So can you regrow the gum tissue that you've already lost? Well, currently, to my knowledge, once that gum tissue has receded, that means that the bone has gone, and once that's happened, your gums cannot grow back. They can only stay where they're at. They cannot come higher up. Yes, the bone tissue can reharden, but my understanding is it doesn't regrow. It doesn't come back to its original height. And hence you can't regrow the gum because there's nothing to support it on, nothing for it to grow back over. The good news is that the bone tissue can reharden, it can strengthen. So if you've got loose teeth, which is a very common sign of advancing gum disease, by taking care of the problem, it will allow the jaw to remineralize and strengthen, and your teeth can tighten back up in your mouth. So now that you understand the real causes of gum recession, it makes sense that we want to take the steps to support optimal bone remineralization. And I'm going to discuss this in a future video, so be sure to look out for something along the lines of how to stop receding gums on this channel. And if you're concerned about the health of your teeth or gums, then give us a call and book in a comprehensive consultation. Our number is 0737201811, or you can email info@evolvedental.com. I hope you've enjoyed the video. If you have, please like, subscribe, ring the little bell, leave us a comment, ask us questions. I am Dr. Rachel Hall of Evolve Dental Healing, holistic dental practice in Brisbane. Thank you so much for joining me. Until next time, bye-bye.